Hello, I am Dr Manjiri Valsangkar, Director, Bhide Hospital Test Tube Baby Center, Navi Peth, Pune. Today, let us talk about when should you see an IVF specialist. Now, most of the times what happens is whenever the word IVF specialist is uttered, patients think that we are directly going to do a test tube baby on the patients. It's not like that. If you are unable to naturally conceive for a year's time, even after a regular unprotected intercourse, it is time that you need to see your fertility physician or your infertility specialist or your IVF specialist to be able to understand the exact nature of the fault in the reproductive system of the male and the female partner. Now what happens is whenever you are unable to conceive naturally, there might be some disturbances in the hormones which are responsible for the reproductive meiosis, as well as sometimes there can be some anatomical defects as well. So we call the patient on the second or the third day during her menses to do certain blood hormonal investigations, and we find out what is wrong. Apart from the egg development, there are certain hormones like the thyroid, prolactin or the sugar levels which might be responsible for irregular menstruation as well as defective folliculogenesis. Now, once the female partner is evaluated by blood hormones, her sonography, which is known as the AFC scan, is done on second or third day of the menses, which helps me to analyze what is her egg reproductive score, and accordingly we can plan the treatment for this patient. After this AFC score, it is very clear to us whether this patient is a good responder patient, whether she is going to be a poor responder patient, which means she might have a less egg reserve, or she might be a very hyper responder patient or a PCOS/PCOD syndrome patient. Now, once we have analyzed the female partner, simultaneously or parallelly, it is very important to analyze the male partner as well in the form of basic tests like the semen analysis of the husband along with certain blood hormonal investigation and blood infective parameters. Once both the male-female partners are analyzed thoroughly, it's time to do the HSG X-ray or the laparoscopy to know whether both the tubes, that is the fallopian tubes which carry or transport the egg and the sperm, is patent or blocked. To understand this, we do an HSG X-ray or a sonosalpingography, and at the end of it, now by 8th or 10th day of the menstrual cycle, we have analyzed both partners along with the tubal status absolutely well. If your reproductive score is great, then for 2 to 3 months, the doctor helps you to plan a pregnancy by giving certain medicines which will improve the quality and quantity of your eggs as well as the sperms. After these 3 months, in case you do not get pregnant, your fertility physician, which will assist you with the form of basic technology like intrauterine insemination or IUI cycles. Mind you, you can do only up to 3 IUI cycles for the best reproductive outcomes, and hence if you have already failed 2 or 3 IUI cycles, you need to definitely see an IVF specialist in order to know what is going wrong. After 3 IUI failures, if you have already come to your IVF physician, it's time to step up the technology and help you out with the help of assisted reproduction technologies like IVF, ICSI, blastocyst, freezing and so on and so forth. So, my friends, if you are facing fertility problems or if you have tried enough and yet unable to conceive, do not be afraid to see an IVF specialist. We shall thoroughly evaluate you and if required, treat you well so that the time to pregnancy is minimum with the best possible success rates. Thank you.